Take a break. We'll come back. And coming up next tonight, right here on Hannity.
But we have to pass the bill so that you can find out what is in it away from the fog of the controversy.
The bill was passed. We know what's in it. Coming up, we'll explain how Obamacare has brought America's healthcare system now to a tipping point. That and much more with our studio audience as we continue. Glad you're with us. And welcome back to the special studio audience edition of Hannity. Now, President Obama's signature domestic policy achievement, better known as the train wreck that is Obamacare, has proven to be nothing but a failure. Now, from the endless website problems, doctor shortages, rising premiums, millions of canceled health care plans all across the country, I think it's safe to say that Obamacare has brought the American health care system to a tipping point.
After all the votes have been tallied, health insurance reform becomes law in the United States of America.
It's healthcare.gov. The website is designed to be pretty consumer friendly.
I keep getting this error page. It won't let me progress past it won't let me progress past verifying personal information.
They can't get on either. Nope, no luck.
The health insurance is good. The prices are good. I have been as clear as I can be under the reform I proposed. If you like your doctor, you can keep your doctor, you can keep your plan.
Centers for Medicare and Medicaid Services estimated Obamacare would collectively reduce the number of people with employer-sponsored health coverage by about 14 million.
People who like their policies are losing them, and this is being a real burden on the economy.
Staggering number of older Americans are discovering that their longtime doctors are being dumped from their insurance plans.
A lot of young people think they're invincible, but the truth is young people are knuckleheads, you know?
And we bring back our studio audience. Jamul, you're one of the president's biggest supporters. The president said if you like your plan, you can keep your plan, period. You like your doctor, you can keep your doctor, period. And the average family per year is going to save $2,500 per family per year.
And he probably shouldn't have used those words. But do you know how...
Probably shouldn't have used those words.
He shouldn't have. But do you know how much he thinks America is exceptional? He thinks this country is so exceptional.
What does that have to do with my question?
Wait,
I want to know why I was lied to.
Sean, you asked me, so let me finish. He thinks we are so exceptional that we should not have 40 million people without health insurance. I am self-employed. For years, I could not afford insurance. For years, I had a pre-existing condition that stopped me from getting health insurance. So yes, we are exceptional, and we are so exceptional that we are not going to let people die without health insurance because they can't afford it. That's what this
31 million Americans, according to CBO, will still not have health insurance under Obamacare. And
then we need
hang
to
on a
fix
second.
it. But we're moving in the right direction.
Moving in the right direction.
We're not going to go back.
You know, frankly, the problem is that we're not really seeing a real timeline from the Democrats. We keep hearing what Jamul just said. Well, we're going to fix it. But the problem is, I mean, I've talked to a number of members on Capitol Hill, whether it was Nancy Pelosi, I just spoke with Congressman Larson yesterday, and I'm asking, well, when is this fix it going to happen? And
when Republicans come to the table.
But you see, once again, we're not hearing a timeline. We're not hearing a real timeline.
I don't want us to get tied up in too much rhetoric here. When you say 4 million people, when he says 4 million people, when HHS says 4 million people, I want you to know those people are not coming to doctors' offices like mine and getting taken care of. Because even if they have a new policy, we even can't figure out as physicians whether we take it. We got to start making phone calls. Am I listed in that policy? No, you're not. You're not listed on Metro Gold Plus. Let me call up, see if I can get on that. I don't know if that network's going to include me. I don't know what they're going to pay me. In the real life of the doctor's office, this is even more of a mess than people not being insured. They're not getting care.
Gene, Professor.
I agree with what you're saying. It is a mess. But back to Doug's point earlier, and you agreed with it, the problem for the Republicans is they haven't come to the table and offered anything positive. Well, and nobody...
In fairness, individuals have, but as
Americans want to go back.
Individuals have, but as a party, they have not coalesced behind a single plan. That's true.
And
I think that's a mistake.
Problem. It's a huge mistake for the Republican Party.
I have the answer. If they just
you
listen to me.
You got to run for office.
Medical savings accounts with portability, buy across state lines, competition, and you take care of pre-existing conditions.
But the Republicans have to coalesce around an answer, and we haven't seen them do that yet, and that's been a problem.
Listen, some truth.
George Bush,
Bill, you want to respond?
Yeah, you know, I think both parties have really failed here. It's very true what you're saying. Right. On the flip side, I mean, I hear sort of people on the left talk about this very gingerly. It's like, oh, well, it's not perfect. Well, yeah, it's not perfect. It's absolutely horrible. level, and they didn't implement this properly from the contraceptive mandate all the way through the entire plan. I mean, what better way to prove that the conservatives were right than to have your website not even work? So it's been a disaster since the beginning.
Jessica?
I mean, I go back to the point that you actually made earlier, that right now the Republican Party is the party of no. And even just today, Boehner came out and said that because he's got, 126 members with 126 different ideas about how to either, as he said, either fix or change or alter the health care plan that we currently have with ACA, nothing is going to get done. And this is what's been happening over and over again in Congress. It's what we've seen going on. It's why we've got the executive orders issues and everything else happen. There's a gridlock, there's a deadlock, and there's got to be some change. There's got to be some answers.
Keisha, let me go over to Keisha.
Yeah. Acknowledge that there are problems with Obamacare, that it's not a fantasy. We just saw Harry Reid go to the Senate floor and say that this was all made up.
No, everybody's lying.
Everyone's lying.
Everybody that lost their plan is a liar. Everyone that's suffering.
So let's remember, we have a Democrat in the White House. We have Democrats controlling the Senate, and the Senate Majority Leader himself doesn't believe there's a problem.
Keisha.
Sean, the reason why I think there's no solution on either side right now is because we're not in a position to point fingers anymore. I think President Obama is not the first president to start something new or give our country something new that it failed. That happened. So we need to move past that and see where
you
can
say we have to move past that, but wait a minute. We're talking about the thing that's most frustrating, and Father, you back me up here from a moral standpoint. My kids, they do something wrong, I expect it, but it's when they say, I didn't do it, she did it. When they lie to you.
He should be held accountable.
Wait a minute,
totally
but in July of 2010, we know that the White House internally debated whether to tell the American people the truth because they knew people couldn't keep their doctor, their plan, and they'd pay more, and they decided consciously not to tell us.
Well, trust me, he's suffering from that now because his reputation, his ratings in the polls has gone down.
Todd Starnes.
Wait just 1 second. You talk about suffering. Just earlier today, I received an email from a friend of mine in North Mississippi. A Baptist preacher lost his insurance because of Obamacare. He was out jogging, got hit by a car. He is laid up in the hospital right now with severe injuries, does not have insurance. Churches are having to raise, churches are having to raise money to take care of this man's medical cost. I'd like to see Harry Reid fly over to North Mississippi and tell this man laid up in the hospital that he doesn't have health insurance, that it's all made up. It's all made
Arlene,
up.
Real quick, take us out. Outrageous.
This isn't an accident. The way that the law itself changes health insurance, they knew people would lose their plan because that's how the law is designed, because they're mandating government levels of coverage, mandating levels of benefits. So of course you're going to lose your plan.
That people don't want.
That's the design, that they think government knows what's best. And if you lose your plan, they don't care because you had a junk plan in their eyes.
A risk corridor provision where our tax dollars are going to be bailing out the insurance industry. Humana has already announced that they're going to get something like $450 million.
We're in the wrong business, all of us. All right, I'm going to take a break. And coming